I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country.
A case of Ebola confirmed in Texas. With so many questions and concerns, KXAN News goes in depth to put the disease in perspective.
Since 5 o'clock tonight, we've heard from health officials here in Texas about that confirmed case. We're waiting on a news conference from Texas Department of State Health Services officials in Austin, but doctors in Dallas spoke moments ago. The patient started showing symptoms after coming back from West Africa. He is now listed in critical condition at Texas Health Presbyterian Hospital in Dallas. Doctors made it clear this disease is difficult to spread. Only a person showing symptoms can spread it by body fluids, not through the air like the flu. We're watching a briefing from the Department of State Health Services officials where we expect to learn more about the Ebola sample confirmed here in Austin.
KXAN's Amanda Brandeis joins us live from the state lab in Central Austin with more on what we know so far. Amanda?
Well, behind me is the Texas Department of State Health Services, and this is where the test was done that confirmed that positive result for Ebola. Take a look at this video. It's of previous testing done here at the lab. The blood sample of the patient from Dallas arrived at 9 this morning, and it was confirmed positive at 1:22 this afternoon. The commissioner of the Department of State Health Services says it was the PCR, or polymer chain reaction, that came back as definitely positive for Ebola. We're told there is a specially trained team to handle high-risk assessments like this, and that this lab was certified to do Ebola testing only about 5 weeks ago. Just last week, they had a meeting on what to do if there's an Ebola case in Texas. Now, a press conference is about to get underway any minute here at the laboratory. The commissioner will be answering our questions on this positive Ebola result. We'll tell you what he said tonight on KXAN News 9 and 10. Reporting live in Austin, Amanda Brandeis, KXAN News.
Officials at Texas Health Presbyterian Hospital in Dallas say the unidentified infected man who had recently traveled to Liberia and West Africa is being kept in isolation. The CDC and local health officials continue to monitor anyone who has come into contact with him and will do so for the next 3 weeks.
It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks. But there is no doubt in my mind that we will stop it here.
News about this disease can be alarming. It's already the most widely spread and deadliest outbreak of Ebola ever.
Worldwide, the CDC says there have been 6,500 cases, leading to nearly 3,100 deaths. Today's case is the first one diagnosed in the U.S. That is why it is so important.
And we wanted to know what doctors in our area are doing to prepare for the virus. KXAN's Lindsey Bramson spoke today with a health expert at Seton to find out.
As soon as the news broke, a person was being tested for Ebola not far from home. Doctors at all of Seton's 11 hospitals took immediate action.
They're very knowledgeable about infectious diseases that are contagious and how to manage those patients for their own protection, but for the protection of staff and other patients.
Dr. Carol Ratton is the Chief Quality Officer, one of Seton's top experts in infectious diseases. She says one of the first questions doctors are now asking patients who come in with Ebola-like symptoms is if they've recently been out of the country.
Knowing that we're in an environment where Ebola is a potential, those patients would be immediately isolated.
While it is contagious, you can't catch Ebola through the air, water, or food.
To get Ebola, you have to have direct contact with infected secretions. And so, like I said, our personal habits are a little different from that in general in this country.
Some people we talk to say they're happy to hear hospitals are taking action now and not waiting until a person catches the disease here.
At least you know they are aware of it. They hopefully have the medication that is needed.
I knew when they discovered it in Africa.
Just a matter of time.
Just a matter of time.
And I also reached out to both St. David's and Scott and White officials to find out what they're doing. A spokesperson for Scott and White says, in an effort to take every precaution to protect its patients, Baylor Scott and White Health is evaluating its patients per the CDC guidelines. We reached out to officials with St. David's as well, and a spokeswoman for them tells me they plan to hold a press conference sometime tomorrow. Lindsey Bramson, KXAN News.